Have you ever been in a situation when your gut told you what a medical provider was saying was not the right answer for your baby's feeding difficulties? Have you ever been led to be fixated on your baby's weight, which made it harder for you to enjoy your baby's first months of life? Have you ever supported somebody in this situation? Today on the Milk Making Minutes, you will hear Megan tell a story of difficult birth and redemptive birth, and unnecessary fixation on weight, and then a situation in which she wasn't worried about the weight, but needed to intervene. These stories show us that we can't always predict what will happen with birth and breastfeeding, but that educating ourselves in the best way possible and surrounding ourselves with the right support can go a long way in removing the barriers to feeding our babies. Enjoy. When I began breastfeeding, I was blindsided by how difficult it was. I may have thought I was prepared, but having known only a handful of people who had ever breastfed and only seeing it up close from a couple of them, I had a huge learning curve. Since then, I've become a doula, a lactation consultant, and a childbirth educator. I'm your host, Lo Nigrosh, and I welcome you to the Milk Making Minutes, where we explore breastfeeding experiences through the lens of systemic barriers, so that you know your breastfeeding struggles are not your fault and your triumphs really are the miracles you feel they are.
I'm Megan R. Cooper. I am a mom, first and foremost, to my two daughters. Penny is 5. Amelia is 3. They're growing up so fast. I can't believe my daughter's about to start kindergarten in a couple weeks, which is just nuts. So that's very fun. We live with my husband, Brett, in Madison, Wisconsin. That's where we are now, but I've lived all over the place. In California, Alaska, lots of traveling. We love to travel. I'm a pregnancy and birth mindset coach, and creator of Birth on Purpose. I love your podcast. I love everything that you're doing with it. And sharing these valuable stories, like it's something I so wish that I had when I was preparing for my births and breastfeeding journeys.
Yes, I know. Yeah, I know. I do too. But as we jump into your story, what was your exposure to specifically breastfeeding before you were thinking about having a baby yourself?
Yes, this is great. This is a great question. So, my exposure to breastfeeding was basically none. My mom, she had no desire whatsoever to breastfeed myself and my brother. Um, and so she didn't have any experience with that. And I didn't have any friends who had breastfed yet. But I knew that breastfeeding was really important and something I really, really wanted to do, not only for the health benefits of my baby, but also just the bonding and the mothering. That piece was like really huge for me. So I knew I wanted to try for it and go for it. And I also heard a lot of stories around, or narratives around, this is going to be really hard, and it's not as easy as it seems, and that type of thing. And so I was a little nervous too, wondering, am I going to be able to do this?
The impact of Megan's first birth on breastfeeding was one that we hear all too often and highlights a far too common barrier to being able to breastfeed successfully. She hoped to birth medication and intervention free in order to have the best chances of positive outcomes for recovery and for breastfeeding. And in her words, followed a typical cascade of interventions that ended in an urgent C-section. She needed to be put under general anesthesia for the surgery because she had an epidural that wasn't working. And this is what followed immediately after. Knowing how important the first moments after the delivery of the baby are for breastfeeding initiation and milk supply, think about the impacts of this situation happening repeatedly to upwards of 31.8% of people giving birth in the United States. Mm.
And so I was not there when Penny was born. My husband wasn't able to even be there when she was born. And I didn't wake up after surgery for 2 hours. So I didn't even get to meet Penny for 2 hours at all. And then once I did and I got her, I still I remember I was in the recovery room and my time in the recovery room was basically ending and they wanted to move me, to a like postpartum room, like to my room in the hospital for the rest of my stay. And I do remember advocating and asking the nurses, like, I need more time. I want to breastfeed. Like, I don't want to delay this any longer, because it's already been hours since I gave birth, And so they were very kind and very understanding and were in communication basically like with their supervisor. And so I did end up getting to stay in the recovery room about 30 minutes longer than I was supposed to, quote unquote, so that I could breastfeed her. She really was not very interested in it, honestly. But and I didn't feel like it really was all that successful, but I was glad that we got to try. Yeah,
Mm.
that's how we started.
Yeah. Yeah. What a hard start. And how were you feeling in that moment as you woke up and realized how much time had passed? Um, what was going through your mind then?
I vividly remember waking up, turning to my right, seeing my husband sitting in the chair, holding Penny, looking down at her face, and just feeling very excited and relieved that she was here. And I said, "We have a baby." And I
Mm.
didn't know if it was a boy or girl yet. So I asked Brett, do we have a boy or a girl? And he said, we have a girl. And so that was really sweet. I remember one of the first thoughts that I had was, why aren't you skin to skin with her? Because he was wearing a shirt. The baby, Penny was all wrapped up in a blanket. And I knew, of course, about the importance of skin to skin. And even if I couldn't do it, he could do it. This is something he and I had talked about beforehand, him doing some skin to skin time with the baby as well. But when I asked him about it later, he basically just said the whirlwind rush of everything going on, he just kind of forgot about it. It wasn't as top of mind for him as it was for me. Um, yeah, so I was thinking when I realized like how long it had been, I was surprised for one. It's like, how did this take this long? I was really surprised. Um, and yeah, I just wanted her. I wanted Penny like as close to me as possible immediately,
Mhm.
forever.
And were you feeling any feelings of grief at the time, or were you feeling just a happiness and kind of shock?
I was definitely grieving. The whole birth experience was completely opposite of what I wanted, of course. And so I actually started honestly grieving my birth experience before I had even birthed her, because as I was being wheeled back, um, for the C-section, it was frantic, and there's nurses and doctors all around pushing my bed, and they had me signing a consent form as we're like walking down the hall. I'm trying to hold my husband's hand, and we're hands are kind of being pulled apart almost. And I remember looking at his into his eyes and saying, this isn't fair.
Mm.
I want to redo. I'm having a VBAC. Like, I literally was like, I'm having a feedback before I'd even had my C-section. But
Mm,
yeah, I definitely did grieve that part of it.
yeah. That's pretty phenomenal to already be saying that before you're even in the surgery room. And so 2 hours later, you're able to try to have that 30 minutes of skin to skin and breastfeeding. Did she latch at all or
Uh, n- I Not really. I feel like she didn't really. I remember being concerned about it, and the nurses didn't really. They're like, "Oh no, you're doing it. You're doing fine, whatever." And then even I had a doula as well. She was not there for the birth either, but she was there in the recovery room with us. And she said, "You're no, this is good. Like you're doing what you're supposed to, what you're supposed to be doing with her." And she was encouraging me. I just remember feeling like it's not a, it just didn't feel like enough.
Mhm.
Or my expectations too might have been, it might have been an expectations thing where I sort of thought and had seen videos of babies, um, you know, I mean, some of my favorite videos to watch back then, and still I love it, is the newborn baby crawl, where they
Mhm.
crawl basically over and they find the nipple and they latch. And I kind of had these visions of Penny doing that, but she wasn't very interested. So I was, sort of surprised that she wouldn't be pretty hungry by
Mhm.
time she could finally have milk.
Mhm. Yeah. Yeah, it's a really hard balance when you're supporting someone after birth and a brand new mom between listening to them and validating their concerns
Hmm.
and using your professional expertise
Right,
and seeing a wide range of experiences to know that something is within the range of normal.
right,
And the more I hear stories, the more I think it's really important to just take a step back and maybe just not say, it's fine, you're fine.
right,
No one likes to be told you're fine when you're not feeling
right,
fine.
right.
And maybe it
Yes,
is fine, but in the moment, you don't actually know.
right.
So then you get wheeled to the postpartum area,
Hmm.
and tell us what happens. What as you continue to attempt
Hmm.
breastfeeding and get that recovery time with your baby,
Hmm.
what happens?
So I breastfed her, or attempted to breastfeed her, really like every 2 hours. I remember it being very difficult with my C-section scar. It was very painful. So trying to figure out a good position to hold her in, coupled with the fact that I had never breastfed before, like, and I was in pain, like all of it just was kind of a lot. But we did it, and every time, like, I was very just wanting reassurance and validation. Like, is this work? Like, am I doing this right? Like, is there anything we could do better? Um, I would talk to the nurses about it pretty much every time a nurse would come in. They always told me, like, looks good, you're doing great. Um, I did ask to see a lactation specialist while I was there because I knew they had them. And again, wanted to make sure I was doing as much as I could, and that I was breastfeeding properly. And it did take, I want to say it took 2 days until I actually was able to see someone, which I found frustrating. But she was, honestly, like, I really wish that I could say that she was really helpful, but I
Mm.
felt a little bit like she was checking up, like I was just on her rounds. And she was kind
Mm-hmm.
of checking me off, like,
Mm-hmm.
you're fine. Here's how you order a breast pump. I didn't get a whole lot,
Mm-hmm.
um, but yeah, so then we went home, continued to breastfeed. The day we left the hospital, Penny, I think we were about 3 days postpartum, and Penny hadn't regained her birth back up to her birth weight yet.
Mm-hmm.
And they had told me when we left, we want you to go in tomorrow to the clinic for a weight check, um, for her, and then yeah, go on from there. And I went to this appointment. We went to the appointment the next day. Went home, continued to breastfeed frequently. She seemed fine. I mean, she seemed happy, content. Would feed, sleep, poop, repeat. Seemed fine. And we went into the appointment the next day. I had to see kind of whoever was there. And she did the weight check, and Penny, I think, had gained maybe like an ounce or something, but still wasn't at the pre birth weight. And so this doctor told me that that she recommended that we go home, we start supplementing with a bottle of formula, and do another weight check in a couple of days. And I was like, it's been 4 days. Like, I don't want to give her formula. I know that giving her formula is just going to impede what we're working on here with breastfeeding, like establishing breastfeeding. I was basically bawling in the room, like, I don't want to do this. And I very much at that time was like a rule follower, and I want to do what I'm being told to do. And I just very much was that way. So it's hard for me to sort of speak up for myself and say, like, no, I don't want to do this. But I did it anyway because I was like, no, I'm not giving my baby formula 4 days, after. Plus, she had gained an ounce. Like, she's moving in the right direction. So, um, the doctor said, okay, how about you go home, you keep breastfeeding, you come back in 24 hours, we do another weight check, and then go from there.
Before we hear how this turns out, I want to tell you all about a podcast I've been enjoying. It's called The Lindsay Elmore Show. This podcast is for people who believe they deserve to be healthy. The show has featured many New York Times bestselling authors and authorities in a variety of fields. Topics have included mental wellness, working with our genes, holistic dentistry, how to eat to starve cancer, parasites, chronic disease, and being your own badass advocate, to name a few. Dr. Elmore is a board-certified pharmacist on a mission to empower others to make educated choices about their own health. I just listened to the latest episode with my kids called Smart Animals, Stupid People, and we all enjoyed it together. I also enjoyed the episodes about embracing pain to resolve it and better living with minimalism.
It was like, okay, yes, I can do that. I was bound and freaking determined. I'm like, she's going to gain as much weight as possible. So we went home, and I literally set an alarm to feed her every 2 hours, even through the night, because it was like, I'm going to just keep feeding her and feeding her. I remember looking up, how can I get her to get more milk? And I read something about basically like sort of expressing, while she's nursing, kind of like pressing down gently on the breast tissue to help the milk, more milk kind of get to her. I remember doing that. And we went in the next day to weigh her, and she had gained 5 ounces. It was such a relief, and everyone was happy. And I didn't give her formula. And it was just like, I feel so grateful that I didn't take the advice of the doctor, because I don't know where we would have been if I had. And I knew intuitively because I was home with her and I was breastfeeding her. I knew she at that point like had a good latch. She would drink, she would stop when she was done, fall asleep, right? Like, she was doing everything a baby is supposed to do. I just knew. Like I just knew. So I'm glad I followed my intuition on that for sure.
This is another story too commonly told. A breastfeeding baby who is completely healthy otherwise is being judged by one measure: weight. This doctor was not asking about pees and poops, the disposition throughout the day, the skin tone. She did not do a weighted feed to see about milk transfer in a single feed, if she was even concerned about that. She did not ask when Megan's mature milk came in and calculate for that and reassure her about the size of her baby's tummy, which is really small in the first few days. She simply saw that she had not returned to birth weight, which is very normal given the cascade of interventions that Megan endured and the timing, and gave formula as the solution. Formula sometimes is the solution, but it is not the solution every time. And there are multiple measures of a baby's health, not just weight. You mentioned that you had this intuition, and then you go to the pediatrician, and the pediatrician says, you haven't gained enough weight, which is ridiculous. Babies gain weight in their own time. And there are times when, yes, baby hasn't gained enough weight, transfer of milk isn't happening,
Hmm.
but weight is not the only thing we're looking at there. There are lots
Hmm.
of things we're looking at to make sure baby is transferring enough weight
Right.
or transferring enough milk. And then all of a sudden, when a mom thinks, oh my gosh, I thought my baby was doing great. I thought I knew my baby well. This expert is telling me my baby's not doing well. I must not be a good mom.
Hmm.
And then that seed of doubt gets planted early on, day 4. And suddenly, I'm not a good mom. I don't know my baby. I can't trust my instincts. And that seed gets carried throughout your motherhood journey.
Yeah.
And that's why breastfeeding is important, one of many reasons. But that's why it's so important to empower women to
Yeah.
feel good about breastfeeding and that they can
Right.
do it.
Right. It's so powerful. Like that is so powerful to me because um it's just articulated my exact experience. I was I went on to keep breastfeeding Penny, and I did regular I went to a breastfeeding support group at the hospital. I did weight checks with her. She always was progressing. She was like lower on this her weight was around the 30% mark, but it always stayed
Mm-hmm.
there. Um,
Mm-hmm.
and it I just I kept going to this support group for a really long time. I kept checking her weights for a really long time, probably 6 months.
Mm-hmm.
Because I kept thinking and worrying, like maybe I don't know or whatever it is. And every appointment I took her to too, um, with the doctor, and now, like in retrospect, I definitely should have switched doctors. I didn't see that initial one again. I saw a different one, but I think the whole
Mm-hmm.
practice was very similar minded. And they always sort of said, "Okay, we're watching. She is staying on her curve, but it's the 30 percentile, so we want to keep watching this." So yeah, it took a long time to finally feel like I know I know what I'm doing and like I was right to trust
Yeah.
myself.
Yeah. And that's the nature of a growth chart.
Yeah,
Not everyone can be at the 90th percentile. That's not what a
exactly.
growth chart is.
Right. Exactly.
Somebody has to be at the 30th percentile.
Right.
Otherwise, it's not a growth chart.
Right.
And if you had been formula feeding from the beginning, would they have been hounding you like that?
Right. Probably not.
Yeah, we don't know.
Yeah.
Yeah, but your power gets taken away and you're made to feel like you don't know what you're doing. And then that
Right.
spills into other parts of your mothering. You feel like
Yes.
you don't know how to parent.
Yeah. Yeah,
Yeah.
absolutely.
And all along, your baby was growing. You were seeing the
Hmm.
peas and poops.
Hmm.
You know,
Yeah.
she was active. She had her
Hmm.
alert moments. Yeah.
Yes.
Yeah. What are the other things that you were seeing that helped you know that she was transferring milk? Did you do
I
to
mean,
reassure
really just,
yourself?
yeah, I mean, really just everything that you just said, but I mean, I could feel, I mean, I could tell, like I could just tell. Um, which I know is not very descriptive, but I could just
Mm-hmm.
tell she was getting the
Mm-hmm.
milk. And then she had all the signs, everything that you were saying that she was doing well. Um, yeah.
Mm-hmm. Is she still on the 30th percentile to this day
Yes, she
as a
is, and she
kindergartner?
turns 6 in a couple
Yeah.
months.
Yeah.
Same, same growth. Yeah, same
Yeah.
place on the chart.
Yeah. What a surprise.
Right?
Yeah, I'm so
Yeah.
sorry you were made to feel that way by
Thank you.
a medical professional. I want to get into your second story because I
Yes.
know it's a little bit different. But with Penny, did you ever experience um, any pain with her, or any periods of thrush or mastitis, or
No, I never did. I never
okay?
did really have any problems except for this made up problem that I thought I had in my
Mm-hmm.
head where I couldn't trust that she was
Mm-hmm.
doing fine.
Yeah, that's amazing.
That's,
Okay.
yeah. And we went on to breastfeed for almost 4.5 years. Really
Great.
long time.
Yeah.
Which again, just on that same theme of getting permission from others, I remember asking when we were interviewing doulas. I remember asking my doula that we ended up having about breastfeeding and if she had breastfed and things like that. And she said yes. And at the time she had a 17-month-old. And I said, how long did you breastfeed for? Because my goal had been to do 12 months. This was kind of just like my number. And she said, oh, well, we're still breastfeeding. And my mind was like blown because I literally had never heard of someone breastfeeding past a year. Like, that's the only thing that I feel like you hear in society is like this 1 year mark. Um, and that was instrumental as well for me because I was like, oh, you can breastfeed past a year. You don't have to just stop breastfeeding. So,
That
yeah.
17-month-old looked like a teenager at that time.
Right. Right. Totally.
I knew that Megan's second birth was very different, so I asked her to tell us about her journey to deciding on home birth. She was asking her surgeon in the hospital after her first daughter was born about the possibility of a VBAC and began researching possibilities for her second delivery almost immediately. Once she was pregnant, she ultimately chose to deliver at home under the care of a certified nurse midwife.
The pregnancy was really hard. Um, just because I was working as a nurse, working 12-hour shifts. I was on my feet. I was exhausted with a toddler at home, growing up baby.
And you were breastfeeding through that pregnancy, right?
Yes, I was.
Okay.
Yep. Hmm. So this is another interesting thing is I remember thinking this each time I went in for an appointment after 12 months old for a pediatrician appointment. They always ask, what type of milk is the baby getting, or are they drinking juice, whatever. asking about these different milestones. And after 12 months, they never asked me after that ever, are you still breastfeeding? They assumed what kind of milk are they having? Is it whole, 2% one? Are they drinking, juice, whatever? And I always told them, like, she's drinking breast milk still. Like, this is what is happening. And I got like a wide variety of responses. Like, often it was just surprise, like, oh, like they had never heard of this before, which is, I guess, not that surprising. I had never heard of it before I met my doula. Like, I just wasn't aware that people would breastfeed longer than a year.
But they are medical providers. The
Right.
World Health Organization has recommended breastfeeding till
For
2
years.
for
Exactly.
a long time.
Right.
And the AAP just updated their recommendations to be until 2 or for as long as mother and baby would like to continue breastfeeding. So the AAP just did update their recommendations in June.
Mm-hmm. Mm-hmm. Exactly.
Not that all practitioners will know that.
Right.
No.
Yes, exactly. And I had read that. And by then, also, so in addition to the in-person support groups, I joined a ton of social communities. I had joined, La Leche League groups, virtually and in person, breastfeeding groups and extended breastfeeding groups as well, because I loved, again, seeing those examples of people that had done this before. Was really, really cool. And I remember during my pregnancy at one point taking Penny in for a checkup. It was probably at her 2-year checkup. Amelia was born just after 2 months after Penny turned 2. And so I think it was at the 2-year appointment. And the doctor said something that was just ridiculous, basically, like, you may not want to be breastfeeding during pregnancy because it could cause preterm labor, I think is what they had said. And I had read all about this, and I already knew that wasn't like actually true. And by then I finally like felt more confident. It was just like, okay. Nowadays, I would have said something to that provider, like, can you show me the research on that? Or, I would have had a conversation about it. But back then, I just didn't say anything. And I just kind of went on. I did bring it up to my midwife, and she was like, do you want to keep breastfeeding Penny? And I said, yeah, absolutely. And she's like, that's awesome. Keep breastfeeding her. It's totally fine. So we did for 2.5 more years until she was 4.5.
Yeah. But
yes.
So let's hear about, what happened at your birth and how that impacted breastfeeding.
Yeah, absolutely. So I fully, like, at this point, I'm going to have my next baby. It's been over 2 years. I've been breastfeeding Penny so successfully. She's doing great. It's going great. So in my mind, I wasn't even really thinking about it other than I was looking forward to that newborn stage again. I love the snuggles and I love the bonding and all the things. But I did not at all think there would be any troubles or like anything to work through. I'm like, I'm a breastfeeding pro at this point. So I was more, focused on like the birth and will I be able to birth this baby at home, without medication and everything. So the birth itself was everything that I could have ever wanted in a birth. It was so redemptive, so transformative for me, so empowering. I birthed Amelia on my bed in our apartment with my husband, we had 2 midwives and a doula and a birth photographer. And I had like very carefully chosen this support community. And it was fabulous. It was fantastic.
Megan had this amazingly redemptive home birth with a slight hiccup because the umbilical cord was short and the placenta wasn't being birthed immediately. But once that was taken care of, they snuggled in and began breastfeeding. The anxiety around her baby's weight was not being pushed on her, even though her weight wasn't changing. It didn't change at 2 days. It didn't change by 2 weeks. But because the midwife who was doing home birth midwifery care for 6 weeks postpartum was using a traditional hanging home birth midwifery scale, she decided to go back to the supportive support group she used for her first baby that was being led by an IBCLC so she could get weighed on an electronic scale.
That's where I got my first weight with her. And it was the same. It was like the same weight at that point. So then at 3 weeks, she still hadn't gained weight. And now I was like, okay, we need to actually kind of figure this out. So I started working with Adria, the IBCLC. And she was so kind and so sweet. And she watched me breastfeed and asked me a ton of questions. And I think we did a weighted feed, and she maybe transferred like an ounce and a half, a little bit less than we would expect. So Adria gave us the advice to go home and try triple feeds, which is basically where you breastfeed the baby and then you pump after you're done feeding the baby, and then you feed the baby whatever you pump. It's a lot. It's really intense. And when she gave us this kind of homework, it was a Friday, and then we were supposed to come back on Monday, and we're supposed to do this for the weekend every time we fed and see how this went. What I remember when she told us to do this, I was like, oh my God, this is insane. Like, it's so hard to have a toddler at home already and a newborn. Like, I don't know how we're going to do this. We talked to my parents and said, can you take Penny for the weekend? Because we have to do these triple feeds. And like, I just don't think that I can do it with a toddler at home. And so we went and we did these triple feeds. It was a lot of work. And we got back on Monday to see Adria, and she had gained a couple of ounces. Like, it had worked at this point. And what had never occurred to me that first time, and was probably smart on Adria's part, was like, okay, this works. So that means that you actually have to keep doing it. Not, my thought was like, I just am going to do this for this weekend and I'm done. I'm like, we're done with this, which was not the case. So that started a very long journey, a little over 3 months of triple feeds every time that I fed Amelia. And I went through so much mental like anguish about this, because physically and mentally and emotionally it was exhausting to do this this process. And also I questioned myself as a mother, and a huge part of my mothering identity was breastfeeding, period. Like, end of sentence. And so who am I as a mother if I can't breastfeed my child properly, or and give her enough milk? And I really, really, really struggled with that. We were approaching 4 months old. During this entire time, I continued to go see Adria twice a week, and continued to do the triple pumping, the triple feeds. And I had to go back to work at about 3 months postpartum. And when I was back to work as a nurse, I was pumping, of course, while I was at work. I was starting to get very exhausted, especially once I started working. I'm like, I don't know how I can breastfeed, pump, and bottle feed and work and have a toddler and a newborn. Like, I just couldn't do it all. And so I started to look into exclusive pumping, which again, I didn't know was a thing. And I found a lot of really great support around it. But I still continued to just feel like if I were to go to exclusive pumping, that would mean I was failing. That is what my brain sort of I was telling myself. So I had to work through that. And I was literally about to say, okay, I'm going to go to exclusive pumping. This is going to be our journey. Like, she's still going to be getting breast milk. But I have to have this work for me and our life. And that's what we were going to do. And I was about to go to my last ever appointment with Adria. And the day before, I could tell something was different in the latch and the way that Amelia was drinking. I was like, I think she's getting a lot of milk. And the next day, she still was. And we went and we did a weighted feed, and she transferred like 4 ounces or 5 ounces or something, like just she got a ton of milk. And I just knew, like, she figured it out. And so, very interesting turn of events right there at the end. Right at 4 months, she could feed. It was crazy. So that was
Wow.
neat. And so then we continued to breastfeed at that point.
Hey, it's Lo here. Do you wish you had the advice of a supportive lactation consultant that will help you reach your goals, whatever they may be? Each one of you has different goals given the barriers you have faced, the life you are living, and the baby and body you have. If you are looking for a compassionate supporter who understands the science of lactation and milk supply and can fully listen to your story and help you come up with a plan that fits your life, I would love to be your lactation provider. My website is quabbinbirthservices.com. Can't wait to hear from you.
Was she ever evaluated for
Yes.
oral ties?
Yes. You know what? I actually forgot to mention 2 parts to the story. One is we did use some breast milk donation milk from a milk bank as well. So we did do a tiny bit of supplementing, which I like to mention because, one, I didn't even know that was a thing. I actually think back to that first doctor who told us to supplement with formula and thought, why was it never even suggested that you could give donated breast milk? Or why was it never suggested to see a lactation consultant, right? But so that was a little bit of our journey. We spent maybe 6 weeks supplementing like 1 bottle a day with other breast milk. But yes, she was at 3 weeks evaluated for, or actually with Adria. Adria started to wonder if perhaps Amelia had a tongue and a lip tie, like she had looked, and she advised us to go to our family physician to have her take a look. And she said, yes, she does have a tongue and a lip tie. And she, at that appointment, we decided to have her clip both of them. I think both of them. I can't quite recall. There in the office, which was fine. But basically the tissue regrew and it didn't end up helping. So we ended up doing 2 things. One, we started working with an occupational therapist who specifically specialized in tongue and lip ties and breastfeeding. So that was really amazing. I mean, she was just incredible. She gave us exercises to do with Amelia, um, encouragement, support, advice, all these things. And one of the things she advised us to do was to consider a laser lip and tongue tie revision by a pediatric dentist. And so we did do that. We went to the consult and decided to go ahead and do these revisions. It went beautifully. Afterwards, there were certain stretches and things we were supposed to do with her mouth. to make sure that it didn't regrow, reattach basically like it had the first time. And so we did those things. Um, that was hard, and she did not want us to do these stretches on this area that had just been, kind of sliced. So that was its own challenge, but we did do it. Um, and it didn't have an immediate effect. I mean, because we did that around somewhere between 6 to 8 weeks, the laser revision, and it wasn't until 4 months, like on the nose, that she really started transferring milk. But it probably did play a role overall.
So it was another 2 months before it got better. I'm so glad that at the 4 month mark that she turned the corner.
Yes, me too. Oh my gosh, me too. And she breastfed until she was 3.5. So she just, I mean, it was really just, she's about 3.5, just over 3.5 now. So it was just a few months ago that
Yeah.
she naturally weaned. And there were so many times in that first 4 months that I thought, I grieved I pre-grieved that I wasn't going to be able to have that extended relationship like I had with Penny. And
Yeah.
so the fact that she did and was able to do that, I mean, meant and means so much to me.
Yeah, it's kind of it can throw someone for a loop. That first time you had this really difficult birth, and then, you had some kinks in the beginning with breastfeeding, but then it worked itself out pretty quickly, and you had
Right.
this, amazing breastfeeding experience, and it can really throw someone for a loop when they have this beautiful birth experience that they dreamed of, and you've
Hmm.
already breastfed, and
Hmm.
then suddenly breastfeeding is so challenging, and you think, I've done this before, why is this so hard? But every baby is different, and you just
Right.
don't know what breastfeeding is going to
Exactly.
be like. And I'm so glad you were able to find the support.
That was a key piece, support. I mean, over and over again throughout, and it continues to be a huge part of my life now.
And I had another question. You tandem fed because you were
Yeah.
feeding them both. Now, how did that work? Because you were so concerned about milk transfer for the baby.
Hmm.
So, for those months that you were so concerned about milk transfer, were
Yes.
you concerned about the older daughter nursing? How did you manage that?
Yes. So that is such a great question. The first 3 weeks when we didn't really know, like for certain, that there was an issue, I very often actually physically tandem fed them at the same time, which was harder than I expected. Um, and my toddler liked to, like, she wasn't used to sharing, and
She
having
was
another
little.
body even there. So she was like, what is this? What's happening? Um, but I really credit, if Penny hadn't been nursing, my supply, because I waited 3 weeks until I really started to sort of focus on this, I really don't think my supply would have been anywhere near where it was. So I'm
Mm,
so grateful for that. And so then once we figured out that this is somewhat of a problem, yeah, Penny started to get the last of the milk. She kind of got the shaft, which was really, really hard, um, because we had to prioritize breastfeeding and then pumping and giving the pumped milk. And so there was not a lot of milk left, if any, for Penny. So that was really hard, um,
but you
to
probably
navigate.
still liked being latched and having the comfort
Right.
there. I was wondering too, that weekend when Amelia gained,
Yes.
was it a half ounce? How much did she gain? Or
I
was it
think
5 ounces that first weekend?
it was quite a bit. I think it was maybe like 4 or 5 ounces over the weekend.
4 or 5 ounces.
Yeah.
Penny was gone that weekend too. So I was
Yes.
wondering if that contributed
Yeah,
because
that's
she
a
wasn't
really good
sharing the
point,
milk.
actually. I never even thought of
Yeah.
that, but it's a good point.
Yeah. Yeah, and typically we tell people, of course, no, we're not going to starve the baby. But in an issue where we're worried about baby weight gain,
Right.
yes, you do have to make sure the baby feeds first.
Yes,
Yeah, which is
exactly.
exactly what you were doing. Yeah.
Right.
Okay, so thank you so much for spending time sharing your stories, and I know that this has impacted what you do now. You were an RN in a hospital setting before, and now you're focusing on, you do several things, but talk to us about your birth coaching that you're doing, and
Absolutely.
how you're
Yes.
trying to impact the birth world.
Oh my gosh. So you probably heard, I talked a lot about support a lot through the time we've been chatting, and I feel that there is not enough support for pregnant moms, birthing moms, new moms, moms in general period. And one of the parts that's really, really hard during pregnancy and preparing for birth is the mental and emotional impact and the fears that come up, the doubts, the what ifs, the wondering, can I really do this? Maybe you have a decision that you're going to have a home birth, or you make a decision that you're going to go drug free or whatever it is, but you have those doubts and questions. Am I really going to be able to do it? Or you talk to other people who are questioning and adding those doubts to you. And I will say in midwifery care, I personally feel like the care that we get is much more well-rounded in that it's, physical, mental, and emotional compared to the hospital doctor route. The appointments are quite short. They're to the point. They physically want to make sure you are doing fine, you're measuring right, you have good blood pressure, and that your baby is doing fine. Great heartbeat, whatever. Check the boxes. But it really has nothing to do with the mental and emotional parts of pregnancy and birth. And so that is really what led me into becoming a pregnancy and birth mindset coach, just providing that mental and emotional support to women throughout their pregnancy journey, preparing for their birth journey, and then even transitioning, and postpartum has its own host of challenges. So I love working with and supporting women through this time period.
If you have been home birth curious, but are afraid to take the plunge, I really encourage you to reach out to Megan on Instagram. Her Instagram handle is No Fear Home Birth. Find her, follow her, send her a direct message, let her know you found her on the Milk Making Minutes, and decide if home birth could be the place where you could birth your baby so that you feel confident heading into your motherhood journey. Do you have a story like Megan's? Do you want to talk about what it was like to wake up hours after a delivery and just want to feed your baby? Or do you want to get more prepared for responding to a pediatrician who wants to supplement with formula just because your baby isn't gaining as quickly as they would like? Are you worn out from triple feeding and want a better way? Join my Milk Making Minutes community group on Facebook, where we break down the systemic barriers that make feeding our babies so difficult and find simple and doable solutions to the barriers you are facing, or just complain about them. I'll see you there.